Hi everyone. So last time we talked about case taking, and case taking I discussed what things we need to consider, like chief along with chief complaints, along with various other things we need to consider. So after taking your in-depth case, what comes next is prescription. Okay, so once you analyze your symptoms, you find the characteristic most unique symptoms in your patient, the next thing that comes to your mind is prescribing the medicine in proper potency, in proper dosage. Okay, so let's go ahead and discuss that. Today's topic, as you know, is homeopathic posology. Posology is nothing but science of dosage or doctrine of dosages. Okay, so homeopathic prescription depends on three elements, that is the principle, remedy, and the dose. So principle on which our prescription is based is of course, you know, like cures like, or similia similis curantur. Another principle on which it's based is the law of direction of cure, that cure needs to take place from within outwards, from most important organ to least important organ, and appearance of symptoms has to be in reverse order of what they appear during the disease that caused in the patient. Okay, so those are the three principles on which which it's based. The remedy prescription is based on uh, it is based on the, of course, totality of symptoms, most unique characteristic symptoms. Also, the remedy has to be selected on most similar basis, and when the remedy most similar remedy is selected, then comes the dosage. Okay, so dosage, how do we what are the five elements on which dosage is dependent? It's the susceptibility of the patient. So susceptibility is most important part that you need to take into consideration while making a homeopathic prescription, because susceptibility of patient is dictated by patient's age. It depends on patient's habit, it depends on patient's constitution, it depends on patient's environment as well. Okay, so when you select most similar remedy, the more similar the remedy, the higher the potency. Okay, also patient's age, younger patients and children, they require higher potencies compared to elderly patients whose susceptibility is comparatively low. Okay, also habit and environment. What happens is, let's take an example of a patient working, let's say a patient is working in construction company, they are doing hard laborious jobs throughout the day, then susceptibility of that patient is definitely higher compared to patients whose occupation is more sedentary type of jobs. Okay, so that's environment. Habit, construction, or a patient who works in chemical factory or a pharmaceutical factory, that patient is exposed to a lot of chemicals, a lot of drugs. So this patient's susceptibility is low compared to patients who are not working in such situations. Okay, so that susceptibility you definitely need to take into consideration. Also, seat of the disease. Seat of the disease is important because it determines the pathology of the disease condition. Okay, so seat of the disease meaning, let's say a patient is has hemorrhoids. Okay, now if this patient has hemorrhoids, if they are bleeding or not, how frequently do hemorrhoids occur in that patient? So that definitely gives us information about seat of the disease, meaning how far the disease has progressed, or what we call as miasm. Okay, so like in homeopathic diagnosis also involves miasmatic diagnosis. So definitely take into consideration that whether the miasm is sora, syphilitic, or psychotic, and the stage of the disease as well definitely determines the seat of the disease. Okay, so more terminal the disease, less is the potency, and more acute is the disease, higher is the potency. Okay, the next is nature and intensity of disease. Kind of similar to what we talked about, seat of disease, but nature and intensity is also important. If patient's vitality is good enough to react, then definitely go for higher potencies. Now, how do you determine patient's vitality? It depends on how patient is responding to a disease condition. Let's say patient has irritable bowel syndrome. Let's For example, now irritable bowel syndrome is a syphilitic miasm, which is kind of end stage of the disease. But overall patient's vitality or overall patient's health is good, and patient is giving good response to your drug, then definitely go for higher potencies. In similar case like IBS, irritable bowel syndrome or irritable bowel disease, if same patient has ulcerations and bleeding and stuff like that, and if patient is not responding to your treatment or any kind of treatment, then definitely consider lower potencies for that patient. So stage of the disease is important, but also patient's vitality, considering patient's vitality is also very crucial. Okay, uh, another one to consider is stage and duration of disease. So stage of disease we already talked about. Duration of disease is also important. Reason being, if patient has been suffering, let's say patient has pneumonia and patient has pneumonia for 3-4 weeks, then definitely the vitality of this patient is going to go low, because patient has been fighting this disease condition for so long. Okay, so definitely go for low potencies in this condition. Previous treatment of the disease is also important. If patient has been taking like steroids and stuff to get treated, steroids and antibiotics to get treated, then definitely the patient's vitality is again going to be low, on the lower side. And if of course patient is not getting better with steroids and antibiotics, then definitely go for lower potencies. Okay, in homeopathic prescription we use minimal dose. So minimal dose being dose just enough to arouse patient's vitality to cure the disease condition. Okay, so this minimum dose can be the maximum dose, as Stuart Close mentions in his book. So maximum dose meaning it could be 10 potency, which is minimum dose for your patient. It could be 3x or 4x, 3x or 12x potency, which is minimum or maximum dose for your patient. So really you have to consider all of these five conditions or five elements which influence your dose of the remedy. Okay, very important. And if you do not consider all of these five things while making a potency decision or a dose decision, then your remedy might be correct for your patient. It might be most similar, most appropriate remedy for your patient, but it will utterly fail to act, or it can even cause injury to your patient. So be very careful while choosing a potency or a dose for your patient. Then comes point of repetition. Okay, so repetition, how you decided what remedy you're going to give to your patient, what potency you're going to give to your patient. Then comes repetition, how long you're going to tell your patient. Take it for 5 days, 3 days, 1 month, 2 months, whatever it is. So definitely consider repetition whenever necessary. So according to Stuart Close, he says that repeat a remedy whenever it ceases to act. So if you asked your patient to take, depending on the 5 considerations we just talked about, you told your patient take 3 doses 3 times a day for 3 days, for example, and after 3 days, if your patient feels better, but then shortly after a while patient starts developing same set of symptoms you treated for, then it calls for repetition. So definitely wait for the symptoms to cease, and symptoms to cease getting better, and then do repeat your remedy. Unnecessary repetition, what causes it? It can cause pathological damage to your patient. So we do not want to harm our patients. That's why definitely after doing the 5 elements consideration, and after governing to 3 most important elements of prescription, what you need to consider is uh, when and how many days patient, when the patient is going to take the remedy, and how many times the patient is going to take the remedy. And do not repeat unnecessarily from the haste of getting your patient better and better. Okay, so just hang in there, wait for the patient to tell you that symptoms have reappeared, and then you can repeat the dosage. Okay, of course, in chronic prescriptions, we do uh, prescribe on constitutional basis. So once constitutional prescription is given to the patient, we expect that patient will not have reappearance of the symptoms. Patient will be cured of his or her disease. Okay, so this is very in brief, just very brief or superficially, which touched upon the topic of posology. Posology in itself is a huge topic. There are so many things that are discussed by Stuart Close in his book. So definitely, if you have a chance, you go back and read everything, because there's a lot that is discussed. These are just highlighting points from Homeopathic Posology chapter of Stuart Close. So questions, comments are welcome. If there is any topic you want to suggest, I will definitely take into consideration, and I will accommodate that in our further scheduled topics. Okay. What else? Anything else that's going on? You have any questions? You can comment below and let me know. Um, Also, there are several examples that case studies that are discussed by Stuart Close. So he doesn't say that very low potencies, very high potencies, or medium potencies are the ones that are always going to work. So definitely depends on your patient. Just analyze each and every case and make a good decision whenever you're deciding the potency and repetition of the dose. Okay, I will see you first week of the month and third week of the month. And if you have questions and concerns, just post it in the comments section. And if you're interested in learning more about homeopathy, definitely go visit my website, homeopathymedication.com. You can read about me. You can read about facts, myths and facts about homeopathy, general information about homeopathy. Also, there are online courses available. If you're interested in studying homeopathy, you can go ahead, go to contacts form and pop in an email and ask about courses available in homeopathy. So my website is homeopathymedication.com. Definitely go ahead, visit that. Also, from today's session, if you have any questions, post it in the comment section below. If you want to suggest any topic, also post it in the comment section below. All right, you guys have a great Saturday. Thank you for joining. Bye.